Hello my friends, it's Mike coming at you from my treatment room, and today I thought we'd do a short video on intraoral self-massage. Now, as a manual therapist, I have found it possible to teach some basic methods of self-massage on the inside of the mouth to my patients so that they have a way of contacting their own jaw structures when they're experiencing tension and pain. This is especially useful if intraoral techniques are not within your scope of practice, or if somebody is experiencing a lot of tension and pain and they can't get in to see anyone. A lot of the time in those moments, people will go on the internet or they will seek out care which is kind of catastrophizing in nature. And intraoral massage, if done with a spirit of mindful self-compassion and without an intent to enact justice upon the inside of the mouth, can be a very lovely way of relieving some tension in a way that doesn't catastrophize, right? So I thought I'd share with you just a couple of techniques and then we can talk about principles afterward. But let me just preface this by saying, as with all videos of this kind, the internet is not your doctor. So if you're having pain or tension in the jaw and you don't have a sense of its source, get it checked out before you just employ various methods. So here's the basics. You can teach this to folks without a lot of background information. What they need to know is, first of all, the spirit of the work. You are not trying to lengthen any tissue when you do self-massage. You're trying to interrupt gently a feedback loop of protective behavior, a feedback loop of tension and pain and discomfort, right? So you don't need to push hard. You need to make contact and you need to interact with the tension that you feel there. That's enough. The other thing that it's helpful to tell your patient, your client, is bony landmarks. So really just two bony landmarks. One is the bottom row of teeth. Most people can find that. And the other is the coronoid process, right there, which is behind the last molar, and it is lateral to the last molar. So if you're following along the bottom row of teeth, you find the last tooth, you go a little bit further back and a little bit lateral, and you find this upward projecting ridge of bone. That's the coronoid. You will want your patient to be able to find that. If they can do that, and they can interact with the inside structures of the mouth with some compassion, I think you might be able to teach them some really useful techniques. So here's two approaches. One is thumb on the opposite side of the mouth, so contralateral thumb, or pinky on the same side of the mouth, ipsilateral pinky. In both cases, the pads of the fingers are facing outward, and in both cases, we are approaching it using the bottom row of teeth as our guide, right? So here's the approach with the thumb, and we're basically going to be aiming for Masseter here. We're going to park our thumb on the bottom row of teeth with the thumb pad facing out. And we're going to ride posteriorly until we find the last tooth. Now, right about there, if we bring our outside fingers onto the cheek, we have between thumb and fingers this chunky muscle of the masseter, and of course running through that is branches of the mandibular nerve. You'll notice that the inner surface of the masseter is quite a bit softer than the outside, which means you really don't need to push very hard to make meaningful contact. And basically two methods pertain when you're here. You can gently contact that muscle, and then you can hold your ground with your hand while you engage in some gentle yawning action of the jaw, especially if you're breathing and relaxing your face as you're doing this. This is a lovely way of draining the tension out of the masseter muscle, right? So contact and then just kind of move the jaw like that. Another method is to contact and engage the mandible in some circular movement. So I meant masseter, in some circular movement. The idea is to just kind of sift that muscle. You'll notice a lot of tensed fibers within it. Again, you're not trying to induce pain. If you notice the arising of pain or of any other protective behavior, fight or flight sensations in your nervous system, that's a sign you've pressed hard enough. You can back off, right? So that's thumb on the opposite side. You can kind of grab masseter and associated tissues and do some gentle sifting of that while also breathing and relaxing the face. Pinky on the same side is a great way of parking yourself on the structures that are just to the inside of this coronoid process. We can call that pterygoid or mandibular nerve, whatever you prefer, but here's the method here. You're gonna have your pinky, the pad of the pinky is gonna be facing outward, and just like the last technique, you're gonna use that bottom row of teeth as your guide. So the pinky pad faces outward, parks along the bottom row of teeth, and then you're gonna ride posteriorly till you find the last tooth and then go beyond the last tooth until your pinky pad is in contact with the coronoid process. Stay in contact with that coronoid process and then aim gently for the ear canal. Very soon you will encounter a stoppage. You will encounter tissue that stops you. No need to enact justice upon this tissue. Just make contact. And then similar to the opposite side, you can make contact and then do some very small movements of the jaw with breath, with relaxation of the face. And you will oftentimes get some very core relief to tension in this area. Now, we as massage therapists, manual therapists, have used a lot of muscular metaphors to describe what we're doing, like lateral pterygoid, but I have to say there's quite a lot of doubt as to whether we can directly contact the lateral pterygoid. So I recommend that we just maintain a spacious doubt about what we are really contacting here. What's important is that we do it safely, right? So travel posteriorly along this bottom row of teeth, pinky pad facing out, stay in contact with that coronoid process, and then aim for the ear canal. When you encounter resistance, that's far enough. Make contact with that tissue and then do small yawny motions with the jaw. Maybe breathe, maybe even vocalize. It's very entertaining if you're doing this in the supermarket line, or maybe you're waiting for the TSA at the airport. Just go, oh, yeah. It's quite entertaining to your neighbors and friends. And it might even relieve you of some jaw pain. So those are the two methods, thumb on the opposite side, pinky on the same side, all done with the spirit of mindful self-compassion. The principles here are really in flux for us manual therapists. We used to think that we are inducing some kind of plastic change in the fascial envelope of these muscles, like myofascial release. That really can't be a good explanation when you think about the amount of force that these fasciae can transmit. And then you think about the gentleness of this technique. There's got to be something else happening besides melting the fascia, right? The best theories that I've seen is that you are engaging in a conversation with the local nervous system, what we call the trigeminal system, and trying to convince it not to be quite as protective, right? But you don't know, so it's almost like a question you're asking. Hey, masseter. Hey, pterygoids. Do you really need to be that tight? Could you dial down that tension a little bit? Hey, nervous system. Do you need to perceive as much stress as you're perceiving right now? How about calming down? That's the message that your hands are sending. And so if you can do that, if you can teach your patients to make that kind of contact in a spirit of self-compassion without giving them concepts that increase their sense of catastrophe with jaw dysfunction, boy, have you given them a gift. So try that out, and if you have any questions, feel free to reach out. Thanks for your time. Bye.